have restored power to nearly all 130,000 residents who lost power last week. Now, there are approximately 50 residents who remain without electricity as of this morning. Now, you can view regular updates of power restoration efforts at the Metro COVID-19 website, where you can also contribute to the COVID-19 Response Fund or learn how to obtain direct financial, food, mental health, and social service assistance. And now I'll turn it over to Dr. Alex Shahanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest of coronavirus in Davidson County. We have 3,699 confirmed cases and 35 fatalities. That's an increase of 47 cases in the last 24 hours. And an increase of 239 cases since our update Friday, which is an average of approximately 80 per day. 1,763 of those cases are active, and 1,901 people have recovered and are cleared of the virus. A week ago, our rolling 14-day average of new cases was 100. Today, we are around 90. We are encouraged by the numbers today. However, remember, as we start phase one, this number could fluctuate and possibly increase. Some other positive numbers to report. Last week, 8,338 Nashvillians were tested. That's 2,290 more tests than a week prior. 9.8% of the tests were positive, and this continues to be a good sign for Nashville. Since early April, our positive rate has hovered into the 10% range, which means the severity of this outbreak is stable in our community. Our community assessment centers continue to be a great resource for our residents and who have concerns about the virus. Just last week, we conducted our 10,000th test at the center. And this is a great accomplishment for our city in just 6 short weeks. We've had some great partners in St. Thomas, HCA, Vanderbilt University Medical Center, Nashville General, and Meharry Medical College. Additionally, the Davidson County Sheriff's Department and the Office of Emergency Management are valued partners, as well as is Metro Police. Today, I'd also like to recognize the volunteers who have worked at these centers. This past Friday, I went to Nissan Stadium, and I saw the power of Nashvillians in action. Dedicated volunteers such as Devin and Bill, who have been at the Nissan Stadium site every single day it has been opened, as well as 3 pharmacy students from the University of Tennessee College of Pharmacy who were there for the first time, were volunteering their time. And I thank these individuals, as well as other teams from HandsOn Nashville and many other volunteers who have showed up daily in the rain, in the cold, and the heat, and whose work if without their work, we would not be able to achieve what we have achieved thus far. Today, the community assessment centers are open until 3 p.m. As you may know, the locations are at Nissan Stadium, at the old Kmart in Antioch, as well as at Meharry Medical College. As always, our assessment hotline is open today and every day from 7 a.m. to 7 p.m. Please call 615-862-7777 if you have any questions or concerns about this virus. Our medical personnel are standing by and are happy to speak with you. Now, as we enter phase one and we start a new normal in our response to this virus, I've asked Dr. Caldwell to develop a plan to better partner with all of Nashville. The department will work with public safety officials, elected officials, and representatives and leaders from the community. This will include even more involved outreach to minority and immigrant communities on education, expanding testing, isolation protocols, and other issues that may arise as a result of this virus. This group will set practices and make recommendations to better ensure the safety of all Nashvillians. This morning, as the mayor noted, we have entered phase one of the reopening plan. Phase one is our first step to open the city back up. Remember, you have to play a big part in this. Stay at home if possible. Work from home if you can. If you're over 65 or have underlying medical conditions, please be extra vigilant. Wear face coverings when out in public, and please, no gatherings of more than 10 people. For more information on the roadmap, please visit our website, covid19.nashville.gov. And now I would like to introduce Mr. Ken Wright, Senior Vice President of Waffle House Restaurants. Thank you.
Good morning, Nashville. I want to thank the mayor and the mayor's task force for giving me the opportunity to discuss Waffle House and our current initiatives. as we move into the next step of our recovery. These initiatives and protocols are in line with the governor's, Mayor Cooper's task force, and the CDC guidelines. I know these have been very difficult times, and I certainly appreciate the collective leadership of the mayor's task force during this public health crisis. Like most restaurants and businesses, our top priority is the safety of our associates and our customers. There is nothing more critical. We do have 14 restaurants in Davidson County that are moving to 50% capacity today. The operations team and I have worked through these restaurants this past week to ensure that we are set up for social distancing and we have enhanced sanitation and safety measures in place per set guidelines. We do have some experience with this transition. We have 25 restaurants in surrounding counties that transitioned to 50% capacity this past in late April. We were very encouraged with the patience and compliance from the customers. The customers seemed very grateful to have an opportunity to have a taste of normalcy. We are fortunate in the fact that all of our open restaurants were set up for to-go, takeout, and delivery. During this time, we were and continue to screen associates. We are sanitizing critical touch points in the restaurants every hour. We're wearing masks, and we are certainly exercising social distancing. Food safety and food handling have been cornerstones of Waffle House culture for many, many years. We are hopeful that we continue to see improvement during this crisis and the opportunity to get this industry moving forward. Of course, as I said earlier, our number one priority is the safety of our associates and our customers. Our number two goal is to ensure that we protect the jobs of the associates. And phase number one is an important step in that direction. As we move into phase one of the recovery, we are ready to give our customers and community the same Waffle House experience we've always been proud of for so long. We want our associates, our guests, and our community leaders to feel comfortable as we reopen restaurants, providing smiles, hot food, and a safe environment under the big yellow sign. Thank you.
Thank you, Mr. Wright. I'd now like to introduce Lori Shinton, President and CEO of HandsOn Nashville.
Good morning, Nashville. Thank you, Mayor, and the entire task force. As the name partner for volunteer engagement for the city, HandsOn Nashville is honored to be part of the long-term plan for disaster recovery, as well as our ongoing response to COVID-19. Since the March 3rd tornado, more than 30,000 individuals have registered to volunteer, and more than 10,000 individuals have served, some of them many times via han.org at more than 1,100 disaster relief projects with our community partners. In mid-March, Han restricted its volunteer projects to those meeting critical needs in the wake of both disasters and began limiting volunteer group size to honor social distancing guidelines. We have and will continue to align with the guidelines set forth with the mayor's roadmap to reopening Nashville. I want to say a few things about our ongoing work in the community. There is a continued urgent need for volunteers. For instance, the community assessment centers where drive-through testing is being conducted for COVID-19 have expanded their operations to 5 days a week, and we are in need of volunteers to help with non-clinical tasks. If you are healthy and able, we'd love your support. There are 500 spots open in the month of May, and we want to make sure that all 500 are filled. The community assessment centers have been such a special example of how Nashvillians are staying on the front lines to support our medical professionals and our community members. Of the 40 projects we had in April, we had 2 volunteers that were mentioned earlier that literally participated in half of them. This type of daily, dedicated spirit is exactly what we've come to expect from Nashvillians, but it doesn't make it any less special or impressive. This is just one example of the type of opportunities that people can plug into. We also recognize that as we move through the reopening phases, we will have an increased need for volunteers to engage in remaining tornado recovery efforts. Please continue to be on the lookout for opportunities to join us. We absolutely need your help. Along those lines, if you are a neighbor that was impacted by the tornado and have ongoing needs, we urge you to call the Tornado Recovery Connection. That number is 615-270-9255. We are working with their team to assist with needs that are volunteer friendly, and they are also able to connect individuals to resources far beyond our scope as well. Remember, right now, Nashville Strong means Nashville Safe. We will continue to follow the guidelines, and we urge all Nashvillians to do the same. Thank you.
Thank you, Ms. Shinton. We will now start the Q&A segment of today's briefing. As I announce your name, you may proceed by asking a question over the air. We'll start with Natalie Yelland at HandsOn.
Good morning. I have a few questions regarding face masks. We know restaurants and stores require employees who deal with the public to wear face masks. How does the city plan to enforce that rule? And some businesses may also require patrons to wear face masks. If customers refuse, is enforcement up to those respective businesses? Can they ask customers to leave if they're not wearing one?
Thank you, Natalie. Dr. Caldwell.
Good morning. I'd encourage everyone to go onto the COVID-19.nashville.gov website where they can review the specific orders, which is the Public Health Order number 4 and amended Order number 4, which deals with face masks and facial coverings. At this point, all employees who are directly engaged with the public or with other employees are required to wear facial coverings or face masks. If that is not occurring, please talk to the manager of the particular store. Let them know right away. If you feel more comfortable, you could alert us through Hub Nashville on your smartphone or on the COVID-19.nashville.gov website. So employees who are publicly facing are required. I do commend those particular businesses that not only are following the order to have the signage to encourage everyone to wear cloth face masks and facial coverings when they enter. Some are also requiring it, those businesses themselves, that you cannot enter this facility if you have a facial covering. Now, that is up to the business themselves. I do appreciate that. But I'd like to caution all of us right now. We're slowly trying to adapt to a new social norm. Some of us are much more early adopters than others. And I would ask for this to be a time that we provide leadership, that we model each other, we show appreciation for best practices, but we do not have an increase of any tension. It is very important that we work together. Anyone under the age of 2 months should not be wearing a face mask. Anyone who says, I have a medical condition and I cannot wear a face mask, they should be believed. They are not required to show any medical documentation. So thank you.
Julia Palazzo at WKRN. Julia.
Good morning. Thank you. My first question for Dr. Jahangir. The testing that the National Guard is supposed to help with public housing across the state, saw that the Chattanooga Housing Authority canceled it because they have concerns. I know testing here is supposed to be Thursday and Friday. Is that still going to happen? And a question for Mayor Cooper, actually, 2 questions. Have you been talking with Dr. Battle and the school district about reopening? Your concerns with that? And also, you know, we saw the NFL schedule released. The Titans planning on having that first home game. I think it was September 20th. Do you think it's possible that we're going to have fans in the stands around then? Thank you.
Thank you. We'll start with Dr. Jahangir.
Thank you for the question. My understanding that testing is Thursday and Friday, but I want to be very clear. This is not a metro Department of Health or city testing, so we don't actually have much involvement with what MDHA is doing with the Unified Command. So I defer further questions on that to MDHA and the Unified Command. Thank you.
Yes, I have been meeting with Dr. Battle, and I know there's a group working on the reopening of schools. I was very excited today to read about Germany reopening its schools, showing that there is, with a lot of protocols, paths going forward. And then in terms of large arenas, we are all crossing our fingers. And the path of disease here in Nashville has been stable. And we're grateful for that, and let's go socially distance, get to a new normal, and get to where we can begin to have expanded activities.
Harriet Wallace at Fox 17. Harriet, you're on the air.
Good morning, everyone, and happy Monday. I'd like to follow up about the masks that were handed out. Again, we're just revisiting that because 25,000 masks in one day in a matter of hours just seems like a lot. So my questions are, A, can you speak to whether it's Dr. Jehunger or Mayor Cooper or Dr. Caldwell, speak to the possibility that maybe are some of the masks being set aside? If so, for whom? Is it possible that, someone took some of the masks? Or if you all did indeed pass all of those masks out, what was the process? And how are you going to prevent so many from being handed out in just a matter of hours during the next wave? Thank you.
Dr. Caldwell.
We were really pleased to get so many masks and to be able to hand them out and to communicate with the public so quickly that they were available at our 3 public health centers at Lentz, at Woodbine, and at East. We are not exactly sure when we're going to get the next shipment, and as soon as we know, we have a plan, and we're going to be working also with HandsOn Nashville to help us hand these out. The more we get, the more we can hand out, but it doesn't take away from the fact that there are very easy ways to create your own face mask. There are other face masks available. People should not wait for these, but it's great to be able to supplement them to the community, and I would encourage everyone to do wherever they can to find face masks, but we'll be there to distribute all of these to you. Thank you.
Nancy Amons, WSMV. Nancy?
Hi, thank you. I have 4 questions this morning. First of all, and I know the guidelines refer to taking temperatures of employees. Have you set up a good support system to help the venues do that, the restaurants do that? I have a question about the fairgrounds. Can you comment on the person who was arrested who left quarantine? Are you going to pursue charges on that? Also, the lack of ticket revenue from places like the Titan Stadium and the ballpark, that ticket revenue is what's paying the bonds. How concerned is Mayor Cooper about the loss of that ticket revenue? And my last question comes from a woman who's over 70 who asked me to please ask if she feels discriminated against by age discrimination because she can't go to her dentist yet. Sorry for all the questions, but we have a lot of them today. Thank you.
Thank you. Dr. Jehunger?
So thanks. I think we're going to break up your questions, and I'll handle the one about thermometers. The Economic Recovery Group, Commissioner Ezel's group of the state, on their website has a link that thermometers can be purchased. They've resourced places in the state and other places they vetted that can sell those. So I defer businesses to that. So as far as infrastructure, that's one way to obtain those thermometers in a way that the state's working on that. That's kind of our thing in regards to helping with that. If businesses need further guidance, I also defer them to the toolbox on our website, COVID-19.national.gov, that could also provide them more guidance around that. But actually purchasing of thermometers, I would defer to the state as they've been leading that. And Dr. Caldwell will answer your other question. Thank you.
The individual that was arrested due to the quarantine was because that individual did not follow a health directive for quarantine. These health directives are not a request, but a requirement. So that was what was violated. The purpose and intent of the quarantine is to prevent the spread of disease and the containment of disease spread. And we do have a public health system, and it needs to work to assure the health of the entire public. We do not intend to be punitive. We lead with education, communication, cooperation, and appreciation, but also expectation. Now, this particular health directive was for the period of 7 days. And because even though the expiration of that is later today, it is the intention that the case should not be dismissed. This should result in some kind of fine or plea of guilt. We do not intend to keep this individual incarcerated or quarantined beyond any reasonable time, but there was a violation, and that needs to be addressed.
Nancy, I'm sorry, I had also missed your final question regarding, I believe it was a 70-year-old individual at a dentist. There are no rules around who can or can't go to dentistry. All those rules are set currently by the state, and I would defer or refer your person who you spoke with to the Board of Dentistry at the Department of Health for the state, and Mayor Cooper will answer your final question. Thank you.
Well, yes, Nancy, I am, of course, concerned at the lack of revenue. There is a city guarantee on stadium debts and these public facility debts. All the more reason for us to get back to normal. And it's not just the sports teams, it is all of kind of our hospitality area is hurting. But yeah, the specifics of your question is the lack of ticket revenue is a concern, not more than the rest of Nashville currently, but it is true there is a city guarantee on all those revenue bonds located around it. But we're a long way from that being an urgent problem right now.
Brett Kelman at the Tennessean. Brett?
Morning, everybody. I would like to discuss what happens in the scenario where a restaurant or retail store does not follow the guidelines that have been issued by the city, and beyond just misunderstanding, decides to defy by, for example, having live music or letting too many customers inside or opening its bar. I think we all hope these things don't happen, but they might. So I was hoping that Mayor Cooper or someone could explain sort of the levels of enforcement tactics that you guys have and what the ultimate consequence could be if necessary.
Okay. Thank you, Brett. Mayor Cooper?
Yeah, thank you, Brett, for your question. Public Health Department is here to protect the safety of all citizens. It is your right to be safe, and safe not just at home. Safe out in the community, at restaurants and in retail. The first phase of this is going to be a lot of education for every place where the public can gather, in restaurants and retail stores, to understand how to be safe. There's going to be some coaching, and there's going to be some visits in doing that. Should a venue persistently not try to keep its customers or staff safe, should that happen after lots of education, then of course it is the right of the Public Health Department to pull all of its permits, allowing it to operate as a public business. People have the right to be safe, and not just safe at home. They need to be safe when they go outside. People have worked very, very, very hard in this town to limit the spread of the virus. And we have to honor that work. We have to value it. We have to enforce it. We will encourage people not to patronize. I mean, in part, it's public notice. Public notice. can be involved with people understanding that they're not going to be safe in a particular spot, and that the ownership is not valuing customers, is not valuing the citizens in Nashville and all their efforts. We are in a situation together. We can, as neighbors, make it work, and it's inappropriate for one party to endanger the rest of us, or more of us, and to be lazy, frankly, and not protecting its staff and its customers, and from that laziness, endanger the rest of us. So, of course, public health. Public health has a long history in Nashville in keeping people safe. When there's an inappropriate action, I mean, we require people to wear seatbelts because it keeps you safe. Well, this is a lot bigger than seatbelts, right, frankly. And so, of course, I'm going to encourage public health first to educate. Educate again. But yes, if people are going to flagrantly defy what's in the interest of our whole community, then the whole community has to respond. But so many people are behaving responsibly. So many business owners are doing the right thing. So many people realize it's the confidence. So you have to be safe and have a reputation for safety, and that's what's going to get us all back to work sooner.
Our last question today is from Kara Hartnett of the Nashville Post. Kara?
Hi, thank you. Are tipped workers still able to receive financial support from the COVID response fund or any other types of financial aid while working at half capacity?
So, what kind of workers, Kara? Could you repeat that, please?
Tipped workers.
Tip workers. Tip workers. I'm going to follow up with you by email and get you a response to your question once we wrap up here today. A recording of the event will be made available later this afternoon. Thank you everyone for joining us. I'd like to especially thank Mr. Ken Wright from...
And you've been
Waffle House.
listening to this news conference with Mayor Cooper and other Metro staff. So the very latest numbers that we are hearing, and we're talking about a total of 3,699 confirmed cases now. We are at 35 deaths in this. It's an increase of 47 cases in the last 24 hours. The good news, though, they're talking about the number recovered. We're almost up to 2,000. Again, this is for Davidson County specifically. One of the key reminders, of course, today is a huge day with both restaurants and retails, the majority of them here in Davidson County, now able to open because this is day one of the reopening phase. We're talking about phase one, and with that, they're at that 50% capacity. The key thing that they continue to remind people, that is to wear those face coverings. That's one of those, and for these businesses to post signs as to what needs to happen. There are many stipulations. We have much more online and on our News 4 app. You can search for that at WSMV. Stay with us. We'll have much more breaking this down coming up on News 4 at noon. I hope to see you then.
We now return to regular programming. Get more updates at WSMV.com and on the WSMV app.